intend to expand the scope of this telemedicine project, and I'm glad that there are so many experts here today who are looking after this, and I will be discussing this matter more in detail with them. At presently, we are using the VPN technology, and in fact, the software which has been which is being used for this Sanjeevani project, for this project is called the e-Sanjeevani, and it has been developed by CDAC Mohali, a local application. We are also doing daily online OPD monitoring. Because the number of hospitals in the government sector is so large, it goes all the way down from your district hospitals, subdivision level hospitals, then even up to your community health centers, and then further down to the PHCs, which are the primary health centers. So the moment we have a monitoring system in place, which we have developed, the moment we have that, we are able to see how many hospitals are actually functioning, how many people have come, how many patients have received the treatment, and also about the presence of the doctors in the field. Apart from this monitoring of the OPD and general issue of drugs, etc., are there indicators of specialization? Because there are a lot of specialist doctors in the field. They could be from radiology, etc. So even their work is being monitored on a daily basis. This covers all doctors, that is allopathic systems as well as the Indian systems of medicine, which would include mainly in Punjab allopathic and homeopathy. This is just a snapshot of the monitoring system which we have developed. This is it can be accessed by the doctors in the field by just putting the username, password. Again, another slide of the monitoring system. This is a very effective method of checking the delivery of health services to the poor in the rural areas. Next, we have the maternal death review. It's very important because now when we are looking at health indicators, the mortality rate of mothers is supposed to be, should be 0. But at present in Punjab, we have 172 maternal deaths per year. In fact, 172 indicates 172 maternal deaths per 1 lakh live births. So our rate of maternal death is slightly less than the national average, but we are working towards reducing that further. And in fact, this software which we have developed, this is a snapshot of the software. This software is important to us because within 24 hours of any such death occurring during childbirth or during pregnancy, this information comes to us and we are able to monitor and evaluate why this whole thing took place and take steps accordingly. And our aim is to bring down the maternal mortality and morbidity during this next 1 or 2 years. There's a very important component. This is called the mother and child tracking system. This is in fact a Government of India application which is being used throughout the country. It tracks all the pregnant women and children. This is because the health care which is to be provided to the pregnant woman and the child, or to a pregnant woman till 42 days after birth, and to the child till about 2 years, so that we can ensure his or her immunization takes place. This is one of the major goals of the National Rural Health Mission, which has been extended throughout the country. So in this particular software, we ensure that monitoring is done so that we ensure that all pregnant women get their antenatal and postnatal care checkups done. The institutional deliveries, our aim is to maximize the institutional delivery so that there should be no delivery outside either the private or the government hospitals. That would reduce the chances of child deaths or maternal deaths. And also to ensure that all children should get their immunizations. So with this particular application, we are able to ensure all that, and we are monitoring it on a regular basis at the state level and at the district levels. This also includes the phone numbers of all the important people in the field, so that we are able to contact them in case of any specific, in case we have to monitor any specific issue. The success of this system can be gauged from the fact that during the last financial year, about 473,000 pregnant women and more than 4 lakh children, they have been registered in the system, and their regular monitoring is taking place. Then we have another very important application which is also again online, and that is called the School Health Monitoring application. This is used to cover all these school-going children. In fact, all the database of all the children is inside this in this software. And we also ensure that proper healthcare facilities are to be given to these school children. So for that, it's not possible to manually get the information. So we have developed this software, which the Program Officer of School Health is monitoring. And we in the NRHM, I'm also the Mission Director of the National Rural Health Mission of Punjab. So we are also monitoring this on a very regular basis. What we do is that during the year, in April, we prepare a roster of the health department to go and check the various schools. So in this particular software, I've given this is a snapshot of that. In this particular software, all these informations are fed, and the date of the checkup which is to be done is also fed. In case there is a delayed checkup, that also is brought into the system. But this way, everyone knows exactly when the medical health and checkup is to take place. So we feel that this is a very important application by virtue of which we are able to ensure that the children who are the school-going children are given their regular checkups. And in case they are also to be referred, in Punjab we have a system that major diseases like cancer, thalassemia, coronary heart disease or rheumatic heart disease, even dentistry and optics and ophthalmology, even these are regularly checked. And in case there is any student who requires any such treatment, he or she is referred to the hospital, and the treatment is given free of cost. Then nowadays female feticide is a burning issue. It has been for the last many years. We have the Preconception and Prenatal Diagnostic Techniques Act, which is prevalent here. And it's very interesting what we have done, in fact, is we have created a website. This is an online complaints system. This website is called sadibeti.org. Sadi Beti means basically in Punjabi it means our daughter. So this is a website by which anybody can send a complaint, whether by name or anonymously, to the health department. And he can also, if he wants, he can ask for his name not to be disclosed. But in case of any complaint against any center running prenatal diagnostic tests, those complaints can be sent on this website, and this website is monitored daily. Awareness of this website, because this website has just been created last year, but awareness, we are trying to work on creating more awareness of this thing so that people are able to submit their complaints. And I've just given you a few snapshots of this thing. I would request all of you who are interested to, if they can have a look at this complaint. We feel that in the coming days or coming months, more awareness about this will lead to the public coming up with information and complaints so that necessary action under the Act can be taken. At the same time, this website also gives a lot of awareness. It gives the names of the doctors who are to be contacted in case the names of the doctors are there, in case anybody wants to contact them. And it also has a methodology of complaints monitoring so that any person who has given a complaint can always refer back to this website and see exactly what the status of his or her complaint is. These are, for example, the names of the doctors and addresses, telephone numbers, etc. Complaints so far, we have received 38, out of which we have issued show cause notices under 15, and suspensions of these centers, 2 centers has already taken place. On a lighter note, though we normally like to monitor patients, people, etc., we also have an equipment monitoring system by which we are able to track and update the AMCs, etc., of all the equipments. And also, very importantly, in fact, I think the major aim why this was actually done was to see that a lot of expensive equipments are placed in the district hospitals, etc., to see whether they are actually being used to see whether tests are being carried out on them or not. And also in case there's any breakdown or any other issue, we can take care of that. We have 24 mobile medical units which are traveling throughout the state. These are loaded with GPS devices, and we are able to, these have, in fact, they have X-rays, and all these diagnostic tests can be done on these machines. ECG, etc., is all within those things, and they are all equipped with GPS devices, so we are able to actually monitor exactly where they are and how much, which routes are they taking, as are they according to the route plan, etc. Then we have one, I just missed out in the slides, but I would just like to tell you that we have one A&M information management system. A&M is a very important worker in the field, in the health department. So she is normally required to send a lot of information, and much of the information which we get from the field is from the A&Ms. So we have equipped all the A&Ms with mobile phones, and this would, earlier they used to go and go to the block and then submit their manual reports, so that was very tedious, and it was also not very accurate, and a lot of gaps were there in between. So we have equipped all of them with mobile phones, loaded an application onto that, and now they are able to send all their reports from wherever they are through SMS. So that's one important way in which we have equipped the A&Ms for the reporting, towards the reporting methodology, to submit all their reports through SMS. And therefore, all our information systems which we have got online, the reporting is done through that system. Thank you very much. I have given my email ID as well as the website of the Punjab government and the health, because this is now a comprehensive website. It contains all the NRHM and Punjab Health Systems Corporation and all those departments. It's onto this. Thank you very much.